Coming to the warning signs of diabetes, the most very early signs of diabetes will be easy fatigue, joint pains. The recent research has suggested that a person who have frequent joint pains, myalgias, who suffer from frequent infections like a urinary tract infection or a respiratory tract infection, those who have got skin allergies or other skin condition, it has been found that such patients are more prone to develop diabetes. I am talking much before the signs and symptoms of diabetes develop. These are the prodromal symptoms, I would say. Next, coming to those symptoms that are directly attributable to diabetes are, as we know, polydipsia, polyuria, and polyphagia. These are the most common symptoms. That means excessive thirst, excessive urination, and excessive hunger. Apart from that, there will be excessive fatigue or weakness. Weight loss is a very important factor in diabetes. Also, such patients will be having a frequent skin infections, frequent respiratory tract infections, and urinary tract infection later on. The next thing is, how frequently should we do the blood test in diabetes? So, patients who are pre-diabetic, these patients should be doing sugar check at least once in 6 weeks to 2 months, especially with the modification of their daily activities like exercise and diet and drill, to check the effectiveness of the regime that they are following to prevent the further worsening of the diabetes. In diabetic patients, it depends upon the control of the diabetes to how good control to how poor control is diabetes, and that will decide how frequently should we be checking the blood sugar levels. Patients who are well controlled, they can check every 1 month to 6 weeks, 4 weeks to 6 weeks, once a fasting post-lunch check, and at least a HbA1c that has to be done in about 6 weeks to 12 weeks. That is something that is recommended. Patients who are having very poor control of the diabetes, they have to check the sugar much more frequently. It may be even daily check to weekly check to even hourly check. It all depends upon how poor is the diabetes control. And also it also depends upon the underlying comorbidities. A person who is having a non-healing wound, and if he is having a very high sugar, then for him, for the appropriate wound healing, he should be doing sugar test more frequently, maybe once in 2 to 3 days, to maintain the sugar levels. Similarly, for the post-operative patients, those who are having a recent cardiac pathology and all of that, those patients have to check the sugar more frequently than those who are better controlled.